All right, welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady, and yes, we have an episode on liposuction. Anybody who follows me, listens to my rants on social media, or listens to any of my podcasts knows that I don't want to say anti-liposuction, but I'm cautionary liposuction, meaning I do it, but I do it seldom. I do it cautiously, and I try to advise people to be careful because I genuinely feel like it's being done way too much and way too aggressively. But we are lucky today because we are honored to have one of my patients, Joseph, who's joined us. And we're going to talk about, what are the indications? Oh my God, Joseph's a unicorn. You actually did this surgery on someone. And we want to talk about two key elements about this unique patient experience. One is just what made Joseph so special, and why did you do it on him and won't do it on others? And the other is, we often find that the overwhelming majority of conversations regarding cosmetic surgery revolve around the female population. But that is not the truth. There is probably 25% of all of cosmetic surgery is done by males. It's just that men tend to be very private, quiet, secretive about their experiences. And in an odd way, that makes it so difficult for other men to do it, because at the end of the day, let's be honest, part of the reason why we feel comfortable today to do it is because there's just so much information and conversation around it. It makes it less secretive or dangerous or whatnot. So let's dive in. No further ado. Joseph, welcome to the show.
Thanks for having me. Great to see you.
We're lucky to have you. We're always very honored when one of the patients agrees to be on the show. Obviously, I have done shows by myself. It's just not as good because when we discuss a subject like this one, but then we have you to have as a soundboard, of course, your experience is one of one. It isn't representative of everyone, but it's certainly significantly better to have a conversation with a patient than without. So thank you for being here, because not only is it time, but, you put yourself out there and, you don't have to, so we appreciate it. So, Joseph, let's dive in. Tell me a little about yourself and what brought you to my practice, and what is it that you were looking for, and what is it that we did for you?
Yeah, so I grew up on the chubbier side. I was never really like super heavy or overweight, but, definitely one of the chubbier kids. Felt, self-conscious about being at the pool with my friends and things like that. And so, as I guess grew up and got taller, that kind of, leaned out a little bit, but still a little bit around the stomach area that I just could not get rid of no matter how much I tried. I was exercising, and I'm fortunate enough to be in a financial situation where I could have a personal trainer. And I think before I came to you, I was working out with the personal trainer for about maybe like 9 months, something like that. And, doing my best with the diet situation. And it was just, obviously, I saw progress in certain areas, but there was still that stomach situation that was just, I was still not fully satisfied and happy with. And so I thought, well, you know what, I'm blessed enough to have the money now to try other options, to explore other things. Let me see what's possible. So I started doing research, looking into plastic surgery, liposuction, whatnot. I was also looking into, what is that? The cryotherapy.
Sure.
Exactly. And I landed on, based on my research, I landed on liposuction. And then I said, okay, well, now that I've landed on that, let me find a doctor that has the best reviews in all of LA in all of town. Because, I'm really willing, I would rather spend more to make sure that this goes smoothly, no complications, no problems, nothing. So I went on Yelp, went on Google reviews, did, some reverse engineering of the search functions to try to really find the top reviewed doctor. And then I landed on yourself. So
okay,
that's kind of how.
I'm going to stop you right there. Perfect. That's a perfect introduction. So let me ask you a couple of questions, because for those of you that are listening, you're like, who's this Joseph guy? How tall are you?
I'm 5'8".
Got it. How much did you weigh when you came to my office?
I think maybe 155.
Correct.
Like
You weighed about in the 150s. So 5'8", 155. For any of you who know anything about anything, that's a pretty lean person. That's not heavy set. That's not overweight. I mean, on paper, 5'8", 155 is pretty goddamn good. How old are you?
29.
29. So you're not a kid, right? And when you say you did exercise, you had a trainer. Most of us don't have a trainer. You physically had a trainer, and you were super, super careful with your diet. So here is an individual who came to me, and the question everyone's going to ask is, what is the distinction? And what I want to discuss is what we refer to as the ideal candidate, at least to me. Listen, there are individual surgeons who do what's called high volume liposuction on a patient who's 5'8", 245 pounds with a BMI of 40. And you know what? Great for the patient, great for the doctor. That's between them and themselves. For me, that's not the type of practice I run. So I am fairly strict because I really want to get home runs. I don't want mediocre results, and I'll explain what that is. So I'm trying to identify patients who have a high yield return. Who are those patients? Who is the ideal candidate in my eyes? It's someone who is healthy, 29 years old, exercising and eating well, which you are, not overweight, which you weren't, with a small problem area that is stubborn, that isn't going to require a significant amount of liposuction to make a significant change in your end goal or your happiness. In other words, you look pretty goddamn good, and with a little push and a little help from me, you'll get into that stratosphere that you physically can't get on your own. I'm going to say you could get on your own, but it would require starving yourself, working out 5 hours a day. Like, you would have to take it to another level. And as you said eloquently, you're lucky. This is a luxury. You have money. You work hard. People make money. They do things with it. What do they do with it? They buy jewelry. They go on vacation. They send their kids to college, whatever. And you have opted to utilize your success, the money that you earn, to help yourself look better and hence feel better. So for those of you listening, what initially made Joseph an ideal candidate was exactly what he said, which is, I did everything I could. I was in great shape. I had a small area of stubborn fat. I couldn't get rid of it. And I then decided, look online and see what my options are. So you present to my office. So now let's go through the conversation you and I had. So you come to my office and you're like, all right, I'm going to go and check this out, see what my options are. I think I have maybe exhausted the things I can do. So tell me how your consult experience was, and what were the things that you learned, that you had done homework, and
Yeah. So when I came to your office, I was just trying to. I mean, I really wasn't really sure what to expect. I knew already that you were a conservative doctor, that you had a conservative approach. I knew that based off of your podcast, the interviews, and your YouTube channel and whatnot. And that's kind of that's what I wanted. I wanted somebody who was going to tell me if I came in the office, no, you don't need this, get out of here,
Yeah.
And so
that's actually a smart way to go about it, because you know that I will be your rate limiting factor, because I'm going to tell you more likely than anybody else if I don't think you need it, because to begin with, I'm already hedging on the more conservative side. Got it.
Right. And so, I knew that about you, but I wasn't exactly sure what else to expect beyond that. And I do remember that the receptionist asked me to send my pictures, and she was like, well, let's have Dr. Raban look at it first, and then we'll see. And then you said I was a good candidate. You wanted me to come in. So
why do you think we did that? Why on earth would I see your photos in advance and not just have you come straight to the office when hi, how you doing? I'm looking to do liposuction. Great. Come on the 27th. Here's how much we charge by. Why would I go out of my way and pre-screen you before you came to the office?
Well, not to waste either of our times. And the consultation is on the more expensive side. And so I appreciated that. I really appreciate that.
We don't want to waste your time. And so by me glancing at your photos, because if you tell me you're 5'8", 158, 155 pounds. You could be super skinny and not have anything there, or thin and fit, but have some stubborn fat. And I can tell relatively from a photo, and therefore I can spare you the time and the money. The last thing we want to do is have you come spend your hard-earned money for me to take a look at you and be like, no, you're not a candidate. So that's good to hear that my staff did the right thing. So they're not going to get fired. Okay, good.
Yeah. So, yeah, it was really, I definitely appreciated that. So that made me feel more comfortable and confident going into the consultation. And then we got there and yeah, and you were, very straightforward, honest, kind. And, you basically told me kind of all what you were just saying about how you don't typically do liposuction and, it's only with specific candidates, but you felt like I was a good candidate.
Do you remember what specifically about your examination I said led you to be a good candidate? Do you remember our conversation at all?
Yeah, you said I had thicker skin,
Mm-hmm.
so that was made me a good candidate, and that I wasn't too overweight, or my body fat percentage wasn't too high, and that it was really just a specific, kind of problem areas, like you said. I'm trying to think of what else you mentioned. Oh, I guess like you said that I was exercising, active, already kind of mostly in shape.
So the key thing that I said to you during the examination, so I can do all those things by conversation. What can't I do by conversation? Examine you. I need to physically touch your body. What am I looking for? What I'm looking for is to see what the quality of your skin is. What the hell does that have anything to do with anything? It has everything to do with everything. Because, and what people don't understand and why people keep getting themselves into trouble is the holy grail of liposuction is what's left, not what you remove. It's what's left. And when you have softer, looser, more lax skin, AKA I've had 3 children, and we go in and remove fat and inevitably some connective tissue, your skin that's left behind will not weather well. It will be loose. It'll be irregular. It'll fold. It'll dent. However, if you are an individual who has thicker skin, which you do because A, you're a man. Male abdomens are thicker skinned than female abdomens. 2, you've never had any babies. So if you were the exact same person, exact height, weight, age, work, everything, yet you were a woman who had had 2 children, your skin would be soft and mobile, and you would not be a good candidate. So number 1, you have thicker skin because you're a male. Number 2, you've never had any children. Number 3, you were never grossly obese. So you were never 245, 50 pounds and then lost 100 pounds, because then you would be the equivalent of a woman who had a child. You'd have loose skin. You were a gentleman that was on the heavier set, chubbier, but you lost the weight, and so your skin hadn't gone through that much turmoil. And lastly, you had a very finite amount of fat. I knew exactly where I needed to go and what to get out, as opposed to just globally overweight, like no beginning and no ending. So where do I stop? So I go around the corner and keep going around the corner, and then to your back, and then your lower back. Like you have to end. The areas that you and I discussed, that you and I ended up doing, was your lower abdomen that would then roll around to your love handles. That's called the spare tire. That's the loose sort of layman's term for it, which is this crap that sits at the bottom, which, by the way, I have. And by the way, most people have. And that's the area that most athletic people come in for, because they get a ripped 6-pack above, and then it just kind of just stops. And they can't get past that, over that hill. And if you take your diet, whatever it was, which was obviously good, and turn it super psycho, vegan, no fat, no excess carbs, and you take your working out and turn it up like 2 notches higher, where you're doing like thousands of reps, and you may be able to burn it off, but at what cost? Like, that's not even realistic. I work for a living. Like, I already work out a lot. So that is why, if you're listening, why Joseph was a great candidate. And as a result, why I said, yes, Joseph, I can help you. So We did your surgery, what, 9 months ago, right?
Yes.
Okay. So we did your surgery 9 months ago, and now you're 9 months out. So why don't you tell us what it is, how's it going? What happened? How did you feel initially? How awful did it look? How much did it hurt? All that good stuff.
Yeah. So right after the procedure, it was burning. It was
It
burning.
was uncomfortable.
Yeah, it was uncomfortable.
Liposuction hurts. I tell everybody, nose job, no pain. Breast reduction, no pain. Liposuction hurts like hell.
Yeah. Yeah. And it was swollen. I remember you telling me that it was going to be swollen for, I don't know, somewhere around maybe up to 6 months.
Right.
And so but I didn't know what that, I didn't know what that would look like. I didn't know what that really meant, And so, I'm looking at it in the mirror and I'm like, okay, well, I can tell that, that the contour is improved, right? But I'm still a little, I guess you could say, swollen. Yeah, bloated or whatever you want it. Right. And so I said, okay, well, let's, wait and see. And then I would say probably maybe around 3 months,
right,
is when I felt like it really started to get to where it is now, normalized. And there was a moment where I kind of looked in the mirror and I was like, oh, wow, this looks really good.
Yeah.
I'm like really happy with this, And so, yeah, I would say about, 3 months of being swollen, and then, things started to get better. And then that's when I think I came for my post-op appointment. And I started going to the gym again,
Right.
back in, I think it was in January. So October, November, December, January. So about 4 months after my surgery is when I started going to the gym again. And I was back, I was doing everything that I was doing before, as far as exercises go. But it was, I think, the thing that I was most happy about. You were good to, I think, set my expectations right, as far as, I'm not all of a sudden going to have, a chiseled 8-pack, right after the liposuction. And I think that was one of the most important things, or most helpful things, that I really appreciated before and after the procedure, was level setting expectations. And you talked to me about this in my post-op as well, about just getting me closer to, you gave the analogy of running a marathon.
Correct. The 26 miles.
Exactly. Just getting me closer to the end, and then kind of running the rest myself. And I think
what I say is that my job is to put you in a van, drive you. In your instance, you were doing really well, so let's take you to mile 18, kick you out of the van, and then force you to run the rest of the marathon on your own, right? I'm not going to take you all the way through the whole marathon, but I sure as hell can get you much closer. And if you do, which you have, and do your part, you should get a significantly improved outcome than you were where you started. No questions asked. And you're a testament to that, right? Because I saw you in your post-op and you look fantastic. You look like you did before without the tire. So again, I can't take ownership of that. You were already in good shape, but I kind of kicked you over the edge, so to speak, and got you there. And that's really, really important. Now, to answer your question, I could etch you a 6-pack. I'd have to use what's called high definition liposuction. There are individuals who do it. It's vaser. It's ultrasound. We get really close to the skin. We burn up this fat. We get it almost all gone. All there is skin that attaches. It's a really aggressive liposuction. And again, that's for that individual and that doctor and that patient. That is not my preference or the type of liposuction I like to do. My liposuction patient is you. You are the candidate that I do when I do it, because I know, no questions asked, that if I do in someone like you what I know to do, you will be a home run. And one thing about me personally is I don't like a second base result. You might be happy, you're better than where you started, but to me, I didn't do you justice. So that's a personal thing. I only want home runs, and you're the home run pitch. If you get a good pitch, you can clear the fence. So now that you're out and about, there was some numbness, I'm sure, initially, and that kind of resolved. You're about 9 months out. And do you have any sequelae? You, as anyone who knows you, if you take off your shirt and you're at the swimming pool, first of all, I'm assuming you're confident now, right? Better.
Yeah, absolutely. It's now, because like I said, there's definitely the rest of the marathon. I think, I still have to run myself that I'm still trying to do on my own. But for me, it's primarily standing up now. With my shirt off, you can't really tell that I am or have any fat there or whatever. And I'm really happy about that because you can see, like you said, you can see the definition, whatever. It's just more so when I'm sitting down,
Which
and I think everybody,
by the way, my son is 18 months. When he sits down, he's got a fat roll in the middle. That's because you have redundancy for sitting. If you look at like, I don't know, a triathlete and they sit down, they won't have a fat roll. They'll have a thin roll. But everybody has a roll when they sit down, by the way, because when you stand up, you have to have the excess to accommodate the standing, just as an FYI.
Yeah. Exactly.
So I'm happy that you're happy at the end of the day. All of this nonsense about what I need or not is irrelevant. But for me to make you happy, I need to make sure that we navigate it well. I think you've done an amazing job of hitting the key points about candidacy, idealness, why we picked you, why we did it. We're going to take a quick break and we're going to come back. And we're going to talk about the second issue that I had. Second issue I had is, why are we not having more conversations with men? What is the stigma? What is a taboo? How did you feel going about it? Did you get support? Did you stay quiet? We're going to dive in a little bit to the psychology of male plastic surgery. All right, guys, stay tuned. We'll be right back with Plastic Surgery Uncensored. All right, welcome to the second half of Plastic Surgery Uncensored. Joseph and I are having a deep dive on liposuction in a man. So we discussed the liposuction, which we did quite eloquently, and now we're going to dive into the concepts. So Joseph, you decide you want to do liposuction because you've done whatever you can. You go online, you start doing homework, and you see a preponderance, an overwhelming, a sea of women. Women results, women reviews, women, chat groups, women. What is it about the fact that, why is it, do you think, that there are so few men? Or did you experience, let me back up, maybe I'm being presumptive. Did you notice what I think I noticed, which is there is a deficiency in male presence in the aesthetic world?
Well, when I Googled it, I Googled liposuction for men. And so I was looking at pictures mostly of men, of, abs and stomach area and stuff like that. And so I think maybe because I was looking for it, I did see, a decent amount of that. And I was pretty happy with what I saw. Now I am aware that, particularly when I went to your website and just started like going to actual plastic surgeons' websites, that most of the testimonials and most of the pictures and results are women. But I think for some reason that didn't really it didn't deter me or anything like that, because in my mind I was like, well, if this doctor can do this on a woman, and well, then I'm sure they can do it on me, no problem. So I wasn't really too concerned about, I don't think men get this a lot, so I'm nervous about that. I think more so, what I was concerned about was, you kind of mentioned it, about just like, I guess, the stigma of people in my life, my personal life.
Who knew that you were having this done? Who did you tell before?
My roommate.
Mm-hmm. Did your family know?
No, I didn't say anything.
Did your friends know other than your roommate?
Maybe one other friend.
Okay. And then afterward, did you tell anybody? Hey, by the way, hey, we haven't seen you in a while, Joseph. What you been doing? Oh, by the way, anybody knew? Did you tell your parents after the fact?
No.
So I will tell you, having done this much more than you have, that's unique to men. Women share more. Women tell their girlfriends. Of course, given that they have sometimes you have catty friends and you don't tell them, but certainly they'll tell more people than men do. And men tend to be more like, I don't know, I just didn't tell anybody. It wasn't really all that, which is obviously men and women are different in so many ways, and it is common that way. But then when you go to ask people, sometimes, like for example, it's not uncommon for a woman to want to get breast augmentation and to have several conversations with several girlfriends who have had breast augmentation. Hey, how was it for you? Oh, it wasn't so good. I don't feel so good. Oh, it was amazing. I love it. Oh, your doctor's going to tell you this, right? You want to buy a Tesla, you call a few friends who have Teslas. But in your instance, and it's not uncommon, men don't generally talk to other men. Hey, you had liposuction. Hey, any of you guys have liposuction, by the way? It's just a secret and no one tells anybody. Why do you think that is? Why do you think you just didn't bother telling anybody?
Well, a part of what I was hoping was that I would get the procedure and then I would just go back into my daily life and it would, and nobody would know. It would be like, oh wow, you've just been going to the gym, which I was. It's not like, it's not like I was trying to trick anybody or anything, but it's just like, oh, you've been going to the gym and now you're fit. Great. Because I know that I remember actually bringing it up with my personal trainer before I got the procedure. And I mean, he's a personal trainer, so of course he's going to say this, but he's going to say, no, 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 you don't need all that. That's doing too much. That's crazy. Just exercise. We'll tweak your diet and this and that. And I was like, man, I've been doing this training for 9 months.
Right.
I've
plateaued.
Yeah, exactly. So, I mean, there's just that concept of, oh, well, other men can get in shape by exercise. So why don't you do that? Why can't you?
But you do understand the reason you can't. We are all not created equally. There's a reason. No matter how much I practice, I will not be able to dunk a ball. No matter how much I practice, I will not be able to jump over a hurdle. And no matter how much you exercise and diet, your physiology, your physique will plateau. And there are other individuals, my wife happens to be one of them, who genetically are blessed when it comes to, for example, their six-pack. My son, right now, at 18 months, is ripped because she got more of his genetic, thank God, than mine. So, yes, I don't think that's true. And I think that if you're a trainer, you're biased because you obviously have the gift. Like, you're genetically the one who can dunk a ball. And it's awesome. And you absolutely need to maximize your physical full potential. But you will plateau. That's the time that you reach out for assistance. Once you've given it your all and you're like, fuck, I've done everything I can. There's nothing more I can do. And I don't want to stay here. Like, I just don't. I want to look better. So I think that, I commend you because lots of men want to do their procedure, keep on going. Let's say I do rhinoplasties on men, they're the number one patients who say, you can't use my photos because they just want to just keep it private, keep on going, which I get, I understand, I respect that. And here you were exactly like that. I didn't tell my folks, I didn't tell my friends, I don't really care. No one needs to know. It's not a big deal. Let me do it, move on. But yet you're here on the show, which means kudos to you, because I assure you it is great value to know that what other guys are experiencing is normal. And some people don't need anyone to know anything, and some people need some support, right? Someone's got to take care of you. Someone's got to make sure you're okay. What if a complication occurs? What if something terrible happened to you? No one knew what happened to you. I mean, granted, you didn't go to Nicaragua to get this done. It's not like you're going to be medevac for some place in the Andes, but it's still a procedure, and it's kind of nice for other people. I don't, maybe I'm a baby. I get a colonoscopy and I want my wife and my family, maybe I'm just needy, but so I commend you because you could have just kept on marching, but we reached out to you because, again, we don't have as many males, and we like to highlight male patients as well as female patients because we want to understand that this is an even playing field. Those days of shame on you are gone. Those days that this is only for women are gone. Those days that this is for rich people are gone. And there's really no shame in this. And if anything, of all the patients, you should be the most proud because you maximize your dial more than most patients even do, right? You didn't show up at, 5'8", 220 and be like, yo, I want to just pay for this thing. You did your part, and then you got a little boost, and now you're where you wanted to be, and you own it, as you had said. So I'm going to do a little quick synopsis because I think every time I talk about liposuction, I'd be remiss not to talk about it. So do you remember from hearing or speaking to me what my litany of risks were? What did I tell you need to be careful of? What is liposuction what risks comes with liposuction?
I know you were really were kind of hammering home the loose skin aspect of it.
Loose skin is big one.
You were talking about irregularities.
The second one.
Rippling.
rippling, irregularities, dents, divots, contour, anywhere from small ripples to big old dents, like, whoa, what happened there? Those as one category, and the other is some version of loose skin. And so it's safe to assume that neither of those things happen to you. Otherwise, we'd be really in trouble having you on. But they're big and they happen a lot. Not like other complications we do. Like, let's say you're doing a breast lift. What's the risk that your nipple can die? Less than 3%. That's quite small. In liposuction, loose skin and irregularities, I would argue, I can't say there's a study that showed it. I tell you it's well above 50%. That's significant for a procedure. So I don't know. I've gotten a lot of flack because every time I post this, I get all these haters. But nonetheless, for every one hater, I get like 15 people going, right on. I had that happen to me, or that happened to my girlfriend, or that happened to my dad or whoever. So I think it's just always good to highlight why I'm so anti-lipo. It's because I just don't want you to have a bunch of loose skin and a whole boatload of rippling, because the loose skin then requires excision. I've done a bunch of tummy tucks in patients who've never had kids, who've never lost weight from just liposuction. In other words, the loose skin created from liposuction required a tummy tuck. That's crazy. And then the irregularities and divots and contour irregularities and all that rippling, almost no solution for it. Essentially, it is what it is. You own it and you go live with it. So they're very, very big when they occur, and they occur often. All right. So any exiting words of wisdom for patients who are considering liposuction, since now you're an expert, right? This journey makes you an expert. You can have your own show now. Anything that you think was salient or eye-opening, or just parting words for those individuals contemplating a liposuction?
I would say that one of the things that I was happiest about, that I feel confident knowing that I tried everything that I could beforehand, and so I would say, for anybody considering it, make sure that you're already exercising, 3 to 5 days a week. Make sure that you're already have your diet kind of under control, because I think that when you set those realistic expectations for me, it really helped, knowing that it wasn't just going to be where I'm not exercising at all and I'm eating junk food, and then all of a sudden I'm going to come out looking like, I don't know, Will Smith, or something like that, when he was younger. But, so I would say, just to anybody considering it, make sure that you're already doing everything that you can, and that this is kind of, like you said, just like the last piece to the puzzle.
Well said. And I think that's very true and very apropos. And you were exactly that. And therefore you were, as I refer to, the ideal candidate. And as a result, the ideal candidate with the right surgery should lead to an ideal outcome. All right. Well, Joseph, as always, I am so grateful for anyone who's willing to come and put themselves out there and participate, because it is through you that we can disseminate this information. For all of those you listening, all right, you know what I usually do at the end of every show? I start begging. All right, number one, if you like the show, go write something nice. We don't live in a vacuum. We live in the world of writing negative things about people. That's all we like to do now, is bitch and complain in America. So if you like the show, please go write something lovely. Furthermore, if you found it to be useful, you never know who you love may decide to do something and you'll wish they have had the information. So share the podcast, disseminate it, share it with the people you care about and you love, and we will be grateful. Until then, till next week, whatever topic, wherever we are, signing off as your host, Dr. Rady Raban, on Plastic Surgery Uncensored.